My name is Dr. Bliss Lewis. I'm a psychiatrist and an integrative medicine doctor, and this series of videos will be on the topic of the thyroid and the relationship between the thyroid gland and mental health. And we'll cover a lot of different topics, a lot of ground. So why talk about the thyroid? So thyroid gland is very important. It's a small gland in our neck, and it regulates many different body functions. It regulates metabolism, it regulates energy levels. It also has a huge impact on mental health, on mood, on anxiety, on cognitive function. So why are we even talking about it? Because thyroid dysfunction is surprisingly common, and low-level subclinical hypothyroidism is becoming even more common. And we know from research that issues with the thyroid have an impact on mental health and are like a hidden cause of mental health issues. So we will explore the different, the hyper, the hypo, the subclinical, and impact on various aspects of mental health. So first of all, the thyroid gland produces the thyroid hormone, and those are divided into two, T4 and T3. So T4 is like the thyroxine, it's the inactive form which is converted in our cells into T3, and that's the active form of thyroid hormone. There are medications for thyroid for people who have an underactive thyroid that are both T3 or T4 or a blend of those two. There's recent research which is highlighting and showing us how thyroid dysfunction can impact mental health. So first of all, what about low thyroid? That's called hypothyroidism. And that is characterized by low levels of thyroid hormones. And that kind of thyroid issue is very closely connected to depression. On the other hand, hyperthyroidism, so a thyroid gland that is overactive, producing too many thyroid hormones, that can lead to anxiety and irritability, agitation. Sometimes also I see it with my patients who are taking thyroid hormones and their doses may be too high. You know, there can be this like edginess, irritability, and anxiety that comes, with taking very high doses of pill form of thyroid hormones. And too much thyroid hormone overstimulates the nervous system. Both hypothyroidism and hyperthyroidism can cause issues with our thinking, so cognitive issues. Hypothyroidism can lead to trouble with concentration, trouble with memory, executive dysfunction. On the other hand, hyperthyroidism can cause trouble with processing speed and inattention. There is also a connection between thyroid dysfunction and bipolar disorder. So there's research showing that individuals who have bipolar disorder often have abnormal thyroid function. And abnormalities in thyroid function are connected to mood instability. Right? So correcting any thyroid issues is very important when treating someone with mood instability, just to make sure that the mental health issues are not connected to a physical health issue, to the thyroid, right? Or not exacerbated. Both things could be going on, right? But the thyroid dysfunction can be making the mental health symptoms worse. Thyroid hormones are very important for brain development, and in particular in early childhood and even during fetal development. And abnormal thyroid function in pregnancy or early life can cause long-term cognitive and developmental issues. So it is also very important, and that's routine care, to test women who are pregnant to make sure that their thyroid hormones are at a good level. Thyroid hormones are involved in production and regulating. They affect production of neurotransmitters. And of course, that will have an effect on mental health. And they're also essential for maintaining the physical structure of the brain and for supporting neurogenesis, neuroplasticity, and the myelination, right? So the covering of nerve endings with myelin. And all of that is important for cognitive health, for emotional regulation, and dysfunction in the thyroid function will potentially lead to all kinds of issues. We know that thyroid dysfunction can lead to increased inflammation and oxidative stress, and through that to neurodegenerative processes. So it is very important to know if there is any dysfunction in the thyroid hormone levels and to catch it. So anyone with mental health issues really should be screened for hypothyroidism, hyperthyroidism, and if a low level of thyroid hormone is detected, it's really important to address it, right? The conventional way to address it is with medication, whether it's high or low. And we will also talk about what are the lifestyle, supplement, herb, food, more natural ways of supporting the thyroid hormone and helping the thyroid recover and produce the normal levels of hormones. So especially for these mild thyroid dysfunctions, which are very common, it's important to think about lifestyle interventions. And that is a lot of different things. The first of all, there are dietary interventions, and the first step is to take out gluten and dairy and to switch to a mostly paleo, clean, organic type diet, to detoxify, to exercise, to practice mindfulness. All of these can help to reverse any issues with the thyroid that could be leading to this subclinical hypothyroidism. And Dr. Amy Myers, Dr. Mark Hyman, who are functional medicine doctors, have a lot of information and books on this topic of how to address thyroid dysfunction. Overall, thyroid is super important to physical health and also to mental health, and it can affect mood, anxiety, cognitive function, and overall like mental and emotional well-being. And understanding how it works and knowing if there's an issue are essential when dealing with any mental health condition.